In amyloidosis, amyloid refers to starch-like, and it goes back to an observation made by the German scientist Rudolf Virchow, who saw mysterious deposits in the tissue that stained blue with iodine, just like plant starch. As it turns out, amyloids are actually just proteins that take on an abnormal shape, which makes them stick together and settle in tissues. And amyloidosis is the name given for the disease that develops as a result of the tissue damage from these protein deposits. Normally, our cells produce thousands of proteins each and every moment, and these proteins need to fold into a particular shape in order to do their jobs properly. If a protein folds incorrectly, it's normally spotted right away and destroyed by proteases, which are enzymes that chop up larger proteins into tiny little bits. In amyloidosis, there are a few different ways that protein folding can go wrong. One way is when normal proteins are produced in enormous amounts, and just a small fraction of them folds incorrectly. A second option is that abnormal proteins with incorrect amino acid sequences are produced in normal amounts, and they fold incorrectly. Either way, the misfolded proteins, called amyloids, start to build up. Sometimes there's simply too many of them for the proteases to handle, and other times the way that they're folded makes them tough to break down. It's a bit like a pistachio that doesn't have an opening for your fingers to work with. Nightmare. When the amyloid proteins get excreted out of the cell, they tend to clump together, forming a rigid, insoluble structure called a beta sheet, like a folded sheet of paper, kind of. These beta sheets then deposit in the extracellular space of tissues and cause damage. So amyloidosis is a process where there are extra protein deposits, and there are many different proteins and diseases that follow that same underlying process. In general, amyloidosis can be systemic, meaning that those protein deposits occur in multiple organ systems, or it can be localized, meaning that they occur in one organ. Until recently, systemic amyloidosis was further broken down into primary amyloidosis, which is where amyloidosis was thought to be the main problem, and secondary amyloidosis, which is where there was another known disease process that resulted in the protein deposits. However, this isn't totally accurate, since an underlying disease process has been identified even in the primary form. Okay, so AL amyloidosis, previously known as primary amyloidosis, is where the A refers to amyloidosis, and L refers to the immunoglobulin light chain as the protein that gets misfolded and deposited. In plasma cell disorders, like multiple myeloma, plasma cells in the bone marrow produce more light chains than heavy chains, and those excess light chains leak out into the blood. Since there are so many light chains, some misfold into AL proteins and build up in various tissues. In AA amyloidosis, previously known as secondary amyloidosis, the misfolded protein comes from serum amyloid A. Now, under normal circumstances, serum amyloid A is a properly folded protein that's an acute phase reactant, meaning that it's secreted into the bloodstream by the liver whenever there's inflammation. But when inflammation goes on for too long, like in rheumatoid arthritis, inflammatory bowel disease, various cancers, or hereditary immune disorders like familial Mediterranean fever, there's a lot of serum amyloid A in the blood. And a small proportion of the serum amyloid A spontaneously folds incorrectly into AA amyloids, which end up accumulating within tissues, creating amyloidosis. In systemic amyloidosis, amyloids deposit in various organs. In the kidneys, amyloid deposits can damage the podocytes, which are the cells that line the glomerulus. When the podocytes are damaged, proteins like albumin spill into the urine, which results in proteinuria, protein in the urine, typically greater than 3.5 grams per day, and hypoalbuminemia, which is low albumin in the blood. Over time, with less protein in the blood, the oncotic pressure falls, and that drives water out of the blood vessels and into the tissues, called edema. Albumin and other proteins normally inhibit the synthesis of lipids, or fat, so losing them leads to hyperlipidemia, which is increased levels of lipid in the blood. Those are the hallmarks of nephrotic syndrome: proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Now, in the heart, amyloid deposits can make the heart walls stiff and non-compliant, and that can lead to something called restrictive cardiomyopathy, which is when the ventricle is unable to stretch out and fill up with blood. Over time, that can lead to congestive heart failure. Amyloid deposits can also interfere with the electrical conduction system of the heart, causing arrhythmias or an irregular heartbeat. In the intestines, amyloid deposits can damage the tips of the intestinal villi, which are the tiny finger-like projections that increase the surface area available for absorbing nutrients. When the villi are damaged, nutrients don't get absorbed and simply end up in the stool. Amyloid deposits can also build up in the liver, spleen, or tongue, making them enlarge. Finally, amyloid deposits can injure peripheral nerve fibres, like the ones carrying sensory or motor signals, or autonomic nerves that control things like digestion and blood pressure. In localized amyloidosis, amyloid deposits in a single organ, and a well-known example is Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease, caused when proteins called A-beta peptides collect in one organ, the brain. These A-beta peptides clump together and form plaques that sit outside of the neurons and interfere with neuron-to-neuron signaling. Amyloid plaques also deposit in the walls of the blood vessels in the brain, called amyloid angiopathy, which weakens the walls of the blood vessels and increases the risk of hemorrhage or rupture. These plaques can trigger an inflammatory response that can cause damage to the neurons, over time leading to problems with brain function, like memory. Another example of localized amyloidosis is familial amyloid cardiomyopathy, also known as ATTR amyloidosis. This is a genetic disorder where the mutant transthyretin protein, or TTR, is misfolded and deposits in the heart tissue, causing restrictive cardiomyopathy. In contrast, there's also senile cardiac amyloidosis, which is when the normal TTR protein gradually begins to deposit in the heart. This only becomes a problem though when it's gone on for a long time, so mostly just affects the elderly. Amyloids can also deposit in the pancreas. For example, in diabetes mellitus type 2, the beta cells of the pancreas, found in the islets of Langerhans, pump out more insulin than normal. But along with increased insulin production, beta cells also secrete an increased amount of a protein called islet amyloid A peptide, or amylin. Over time, amylin aggregates between beta cells in the islets of the pancreas, causing inflammation, which leads to damage and beta cell death. The symptoms of amyloidosis can vary widely, depending on what damage is caused. With kidney damage, there's swelling in the face, ankles, and legs. Heart damage can lead to palpitations and shortness of breath, and intestinal damage can cause malabsorption and weight loss. Some individuals develop a large tongue, which can interfere with speech and swallowing, and cause noisy breathing at night. Nerve damage can lead to numbness or pain in the fingers and toes, as well as alternating bouts of diarrhea and constipation, or orthostatic hypotension, meaning that blood pressure falls, causing the person to feel lightheaded whenever they're standing up. The central nervous system is often spared, except in Alzheimer's disease, where the main symptoms are memory loss and difficulty learning new skills. The diagnosis of amyloidosis typically requires a biopsy of the involved organ, or by doing a fat pad biopsy, which is when the fat is taken from the abdomen. The sample is then dyed with a special Congo red staining, which makes amyloid take on a characteristic pink colour. When it's seen under polarised light, the amyloid proteins appear apple green in colour. When it comes to treatment, unfortunately, there's no effective way to remove the amyloid deposits. So if there's extensive damage to an organ, then organ transplantation can be tried. Okay, so let's have a quick recap then. Amyloidosis is caused by misfolded amyloid fibril deposits, which can be systemic in multiple organ systems, like the kidney, the heart, and intestines, or localized to the brain in Alzheimer's disease, or the pancreas in diabetes mellitus type 2. In tissue biopsy, Congo red stain makes the amyloid proteins go pink, and under polarised light they appear apple green. Hey everyone, Sarah here. Cheers for watching that video on amyloidosis. I hope it made the subjects a bit simpler. It was quite a long video, but you've made it this far, so well done. So the script was written by Antonia Saniotti, and it was edited by Rishi Desai and Ifan Chow. And then I did the illustration and the voiceover, and the whole video was edited and put together by Sam Gillespie. So thanks, Osmosis. I hope you liked it. Either way, we'd love to hear your comments, so chuck them in the comments section. And if you haven't seen that we've got loads of other videos, then make sure you subscribe to our YouTube channel. But what you might not know is that we actually have loads more videos that aren't on YouTube on our website, which is osmosis.org. And as well as loads of videos, we've also got flashcards, questions, timetabling program that helps you sort out your whole life when it comes to studies. And that's not just for medicine, although it's fantastic for medicine, but also for other healthcare subjects. So make sure you get to osmosis.org and do that. And I look forward to making the next video for you. Bye!